Taking medications is very much a balancing act, balancing all of their benefits against risk. Because whilst medications have undoubtedly revolutionised healthcare, they can also cause harm. In our hospitals, 1 out of 3 patients experience medication harm, and 7% experience serious harm. Now that's things like bleeding in the brain, kidney or liver damage, and even death. The good news is that studies that have looked at medication harm in hospitals have shown that many of these events are in fact preventable. So if we could identify those at high risk early after their admission, we could stop patients from becoming seriously unwell or even dying because of a medication-related problem. But identifying who is high risk is not so simple. I work as a pharmacist in the busy emergency department at the Princess Alexandra Hospital, where at any time we will have at least 30 patients, many of whom are medically complex. So I frequently ask myself questions like, should I first see this 65-year-old lady? She was recently admitted with a stroke. She has diabetes. She also has multiple other medical conditions, but the doctors are not sure what medications she was taking at home. Or perhaps I should first review this 50-year-old gentleman. Now, he has a history of a liver transplant. He's been prescribed 2 pages of medications. Some are high risk. Who would you prioritize? What my research aims to do is to create an electronic prioritization tool. Imagine a safety net that can catch those high-risk patients for urgent medication review and ongoing monitoring during their hospital stay. To do this, I've divided my research into 2 parts. The first part, which is now complete, looked at how pharmacists currently identify high-risk patients. I conducted focus groups and also a national survey, which had responses from 231 Australian hospital pharmacists. These methods help identify the key criteria that pharmacists use for prioritisation. Things like, why has this patient come into hospital? Are they using any blood thinning medications? Do they have any kidney problems? Amongst others. I'm now using the criteria, as well as medical information that I've collected from 2,000 patients, and with the help of mathematics and technology, going to create this safety net that can take the guesswork out of prioritisation. My goal is to stop medication harm. This safety net can help alert our pharmacists, nurses and doctors every time a patient is at high risk, and tell them why. Thank you.